Question 1. A patient receives 150 milligrams of leucovorin calcium via injection. The HCPCS code description for leucovorin is J0640 per 50 milligrams. How should this be reported? A. J0640. B. J0640, J0640. C. J0640 x 3 units. D. J0641. Answer: C. J0640 x 3 units. This question tests your ability to calculate and report units for administered drugs. The key information is the total dosage administered, 150 milligrams, and the dosage per HCPCS code, 50 milligrams. To determine the correct number of units, you divide the total amount given by the amount listed in the code description, 150 milligrams/50 milligrams equals 3. Therefore, you report code J0640 with 3 units to accurately reflect the service provided. Always remember to check the drug's dosage in the HCPCS manual and divide the administered amount by that number to find your units. Question 2. A physician provides a patient with a standard manual wheelchair for home use. The wheelchair is new. Which code and modifier combination is most appropriate? A. E1161RR. B. E1130NU. C. E1161NU. D. E1230UE. Answer: C. E1161NU. This scenario tests your knowledge of coding for durable medical equipment, DME, and the associated modifiers. The keywords standard manual wheelchair point to code E1161, and new indicates the need for the NU modifier. Modifiers are crucial for specifying the exact nature of the supply, such as whether it's new, NU, rented, RR, or used, UE. In this case, since the patient received a new piece of equipment, E1161NU is the only correct combination. As a tip, think of DME modifiers as telling the payer the story of the equipment: is it brand new, just a rental, or a replacement? Question 3. A patient is transported by a basic life support (BLS) ambulance from the scene of an accident to the hospital. Which HCPCS Level II code reports the ambulance service? A. A0425. B. A0427. C. A0429. D. A0433. Answer: C. A0429. This question focuses on selecting the correct code for an ambulance service based on the level of care provided. The keywords are basic life support, BLS, and transport, which directly point to the appropriate code. Code A0429 represents a basic life support ambulance service, while A0427 is for advanced life support, ALS, and A0425 is for ground mileage. Since the scenario specifies BLS, A0429 is the most accurate code to report the service itself, not the mileage. Always match the level of service documented, BLS or ALS, to the corresponding A code in the HCPCS manual. Question 4. Which modifier is used to indicate the left foot, fourth digit? A. T3. B. LT. C. F3. D. T8. Answer: A. T3. This question tests your knowledge of the specific HCPCS modifiers used for identifying fingers and toes. While LT and RT are used for general laterality, left and right sides of the body, the F and T modifiers provide much greater detail for the digits. The T series of modifiers is used for toes, and the number indicates which toe, starting with T1 for the great toe. Therefore, T3 correctly identifies the fourth digit of the left foot, T1 equals hallux, T2 equals second digit, T3 equals third digit, T4 equals fourth digit, T5 equals fifth digit. A handy way to remember is F is for finger, and T is for toe. Question 5. A Medicare patient receives a screening colonoscopy, but due to poor prep, the physician cannot advance the scope past the splenic flexure. Which HCPCS code and modifier would be appropriate? A. 45,378 to 53. B. G0121-74. C. G0105-52. D. G0121-53. Answer: D. G0121-53. This question tests your understanding of reporting incomplete screening procedures for Medicare patients, which require specific G codes. The keywords are screening colonoscopy and cannot advance the scope, indicating a discontinued procedure. For a Medicare screening colonoscopy that is incomplete, you must use G0121, colorectal cancer screening, colonoscopy on individual not meeting criteria for high risk, or G0105, for high-risk patients, with modifier 53, discontinued procedure. Since the patient is not specified as high risk, G0121 is appropriate, and modifier 53 shows the full procedure was started but not completed. Remember that for Medicare screenings, you often turn to G codes instead of standard CPT codes. Question 6. A provider administers 2 mg of Haldol decanoate via intramuscular injection. The HCPCS code is J1631, injection, haloperidol decanoate, per 50 mg. What is the correct way to bill for this service? A. J1631 with 1 unit. B. J1630. C. J1631 with 2 units. D. A J code cannot be used as the dose is less than the code's value. Answer: A. J1631 with 1 unit. This question tests the rule for reporting drug dosages when the amount administered is less than the amount specified in the HCPCS code description. The keyword is 2 mg, while the code J1631 is for 50 mg. Even though the administered dose is much smaller, payers' guidelines typically require you to report 1 unit of the drug code if any amount up to the listed dosage is provided. You must also document the exact dosage administered, 2 mg, in the patient's medical record, but you bill for a single unit of J1631. The takeaway here is that you can't bill for a fraction of a J code, you bill 1 unit and document the waste, if applicable, according to payer policy. Question 7. A patient with a chronic venous stasis ulcer receives a sterile hydrogel dressing to be used for her wound care at home. The dressing is 4 by 4 inches. Which HCPCS Level II code would be used? A. A6231. B. A6248. C. A6234. D. A4452. Answer: B. A6248. This question requires you to find the correct code for a specific type of surgical dressing based on its material, size, and features. The keywords are hydrogel dressing, sterile, and 4 by 4 inches. You must navigate the A codes for dressings, looking for one that matches all these descriptors. Code A6248 is for a hydrogel dressing, sterile, sheet, 4 by 4 inches, without an adhesive border, making it the most precise choice. When coding for supplies, always look for the code that captures the most specific details provided in the documentation. Question 8. What is the primary purpose of HCPCS Level II codes? A. To report inpatient hospital procedures. B. To report physician services and procedures in an office setting. C. To report injectable drugs, durable medical equipment, supplies, and other services not found in CPT. D. To diagnose a patient's condition or illness. Answer: C. To report injectable drugs, durable medical equipment, supplies, and other services not found in CPT. This is a foundational question about the role of the HCPCS Level II code set. The core concept is understanding what HCPCS Level II is used for in the broader medical coding system. While CPT, HCPCS Level I, codes cover physician procedures, HCPCS Level II codes are used for products, supplies, and services outside of what is included in CPT. This includes items like ambulance services, prosthetics, and drugs administered in a physician's office. Think of HCPCS Level II as the code set that fills in the gaps for everything a patient receives that isn't a CPT-defined procedure. Question 9. A patient receives a pair of single-vision eyeglasses with plastic frames after cataract surgery. Which code would be most appropriate to report the eyeglasses? A. V2020. B. V2103. C. V2025. D. V2201. Answer: A. V2020. This question tests your ability to code for vision hardware, specifically eyeglasses, using the V codes in HCPCS. The keywords are single vision eyeglasses and frames, which direct you to the correct category. Code V2020 is a global code that includes both the frames and single vision lenses, making it the right choice for a complete pair of basic glasses. Other codes, like V2103 for a single vision lens or V2025 for a deluxe frame, are more specific and would be incorrect here. Always look for a comprehensive code first when a complete item, like a pair of glasses, is provided. Question 10. An ambulance is dispatched and provides advanced life support, ALS, but the patient is pronounced dead at the scene prior to transport. Which HCPCS code is used to report this service? A. A0427. B. A0999. C. A0426. D. A0380. Answer: C. A0426. This question addresses a specific scenario in ambulance coding, when care is provided, but no transport occurs. The keywords are advanced life support, ALS, and prior to transport. HCPCS has specific codes for this situation, differentiating between BLS and ALS levels of care. Code A0426 is for an ALS assessment when no transport is furnished, while A0427 is for ALS with transport. Therefore, since the patient was not transported, A0426 is the correct code. Remember to always check if transport occurred, as that is a major factor in choosing the right ambulance code. Question 11. Which modifier would be appended to a HCPCS code to indicate that a service was performed by a physical therapist assistant, PTA, in a therapy setting? A. GP. B. CO. C. GN. D. CQ. Answer: D. CQ. This question tests your knowledge of therapy modifiers required by some payers, like Medicare, to identify which type of practitioner performed or assisted with a service. The keyword is physical therapist assistant, PTA. The CQ modifier is specifically defined as an outpatient physical therapy service furnished in whole or in part by a physical therapist assistant. The CO modifier is used for an occupational therapy assistant. A simple way to remember is CQ is for a physical therapy assistant, and CO is for an occupational therapy assistant. Question 12. A physician furnishes a patient with a knee orthosis that has a double upright, thigh and calf, with condylar pads and joints, but without a flexion/extension joint. It is custom fabricated. Which code is most appropriate? A. L1832. B. L1845. C. L1852. D. L1834. Answer: C. L1852. This question requires careful code selection for an orthotic device based on its specific features. The keywords are knee orthosis, double upright, specific components like condylar pads, and importantly, custom fabricated. You must find the L code that matches this detailed description. Code L1852 describes a knee orthosis that is custom fabricated and includes all the listed components, making it the most precise choice over prefabricated or off-the-shelf options like L1832. When coding orthotics or prosthetics, pay close attention to the details, custom versus prefabricated, specific joints, and materials, as these are the key to correct code selection. Question 13. A patient receives an injection of 10 mg of ketorolac-tromethamine. The J-code for this drug is J1885, injection, ketorolac-tromethamine, per 15 mg. How should this be reported on the claim? A. J1885 with 0.67 units. B. J1885 with 1 unit. C. J1885-52. D. Do not report, as the full dose was not given. Answer: B. J1885 with 1 unit. This scenario tests the rule for billing drug units when the administered dose is less than the billable unit in the HCPCS code description. The keywords are 10 mg administered and the code J1885 being 4 per 15 mg. Even though the patient received less than the 15 mg in the code, you must report 1 full unit of the J-code. Payer rules do not allow for billing fractional units, so you bill for 1 unit and document the exact dosage, 10 mg, and any discarded amount in the medical record. The key takeaway is to always round up to 1 unit when any portion of the drug described by the code is administered. Question 14. An ambulance transports a patient from a skilled nursing facility, SNF, to their primary care physician's, PCP, office for a scheduled appointment. Which 2-letter HCPCS modifier should be appended to the ambulance service code? A. NH. B. NP. C. RN. D. SP. Answer: B. NP. This question tests your ability to use the 2-letter origin and destination modifiers for ambulance transportation. The first letter of the modifier represents the origin, and the second represents the destination. The keywords here are skilled nursing facility, SNF, for the origin and physician's office for the destination. In the HCPCS modifier list, N stands for skilled nursing facility, and P stands for physician's office, making NP the correct modifier. A tip for these is to treat it like a mini-map. The first letter is the starting point, and the second is the end point. Question 15. A provider uses a non-contact, real-time, fluorescent wound imaging device to assess a patient's diabetic foot ulcer. This service is for a Medicare patient. Which temporary HCPCS code would be used? A. A9273. B. C9764. C. G0451. D. S9035. Answer: B. C9764. This question assesses knowledge of temporary codes used for new technology under the Medicare Outpatient Prospective Payment System, OPPS. The keywords are wound imaging device, real-time, and its use for a Medicare patient in an outpatient setting, which points toward a C code. C codes are temporary codes created by CMS to be used by hospitals to report new technology drugs, biologicals, and devices that are eligible for pass-through payments. Code C9764 specifically describes this non-contact real-time fluorescence wound imaging service. Remember that C codes are typically used in the hospital outpatient setting for specific new technologies. Question 16. A patient is fitted for a prosthetic device to replace a foot. Which general category of HCPCS Level II codes would be used for this item? A codes. B. E codes. C. J codes. D. L codes. Answer: D. L codes. This is a high-level question about the organization of the HCPCS Level II codebook. The concept being tested is your knowledge of which lettered sections correspond to which types of services or supplies. The keyword is prosthetic device. L codes are used exclusively for orthotic and prosthetic procedures and devices, such as braces, artificial limbs, and related services. E codes are for durable medical equipment, and J codes are for drugs. Knowing the general categories is a fundamental skill for navigating the HCPCS manual efficiently. Question 17. A physician's office provides a sterile surgical tray for a procedure performed in the office. Which HCPCS code is used to report the tray? A. A4550. B. 99070. C. A4206. D. G0463. Answer: A. A4550. This question tests your ability to code for common medical supplies used in a physician's office. The keyword here is surgical tray. HCPCS code A4550 is specifically defined as surgical trays and is used by physicians to bill for the tray of sterile instruments and supplies used during a minor in-office procedure. While the CPT code 99070 exists for supplies, most payers, including Medicare, require the more specific HCPCS codes. For instance, A4550 would be reported alongside the CPT code for the procedure itself. Always check payer guidelines, but A4550 is the standard for reporting a generic surgical tray. Question 18. A patient receives a low-dose rate, LDR, prostate brachytherapy service, which includes the use of 75 iodine 125 seeds. How would the supply of the radioactive sources be coded? A. A9527. B. C1720. C. C2640. D. 77778. Answer: C. C2640. This question tests your knowledge of coding for specific radiopharmaceuticals and brachytherapy sources, which often use C codes in the hospital outpatient setting. The keywords are LDR, prostate brachytherapy, and iodine 125 seeds. Code C2640 is defined as brachytherapy source, iodine 125, per source, which perfectly matches the item supplied. The CPT code 77778 describes the physician's work for the brachytherapy application, not the supply of the seeds themselves. It's crucial to code for both the physician's procedure, CPT, and the supply of the radioactive source, HCPCS. Question 19. A patient is prescribed an oral anti-cancer drug that they will take at home. The physician's office provides the initial dose. Which section of HCPCS Level II would you find the code for this medication? A. J codes. B. S codes. C. K codes. D. Q codes. Answer: C. K codes. This question tests your knowledge of specific HCPCS code categories, particularly for oral medications. While J codes are for injectable or inhaled drugs, a different category is used for oral anti-cancer drugs and other specific DME-related items. The K codes are used by durable medical equipment Medicare administrative contractors, DME MACs, and include codes for items like oral anti-cancer drugs. For example, K1005 is for an oral anti-cancer drug, not otherwise specified. Remember, the route of administration is key. J codes are primarily for injections, while K codes can cover certain oral DME-related drugs. Question 20. When a new technology or service is being tracked by Medicare but does not yet have a permanent HCPCS Level II code, which type of temporary code might be assigned? A. L code. B. V code. C. G code. D. J code. Answer: C. G code. This question is about understanding the purpose of temporary HCPCS codes, specifically G codes. The keywords new technology and tracked by Medicare point directly to this category. G codes are created by CMS to identify professional healthcare procedures and services that would otherwise be coded in CPT but have no CPT code yet, or for which Medicare needs to facilitate a specific payment policy. For example, Medicare might introduce a G code for a new type of telehealth visit to track its utilization before a permanent code is established. Think of G codes as Medicare's way of creating a temporary placeholder for tracking and payment purposes. Question 21. A patient is provided with a pair of crutches by the emergency department physician to use for a sprained ankle. Which HCPCS code reports the crutches? A. E0110. B. E0112. C. E0114. D. E0117. Answer: C. E0114. This question tests your ability to identify the correct HCPCS code for a common piece of durable medical equipment, DME. The keyword is crutches. Navigating the E-codes for walking aids, you will find several options for crutches based on their type. Code E0114 is defined as crutches, underarm, wood, adjustable or fixed, pair, which is the standard code for the type of crutches typically dispensed in an ER. Other codes, like E0110 for crutches with a forearm cuff, are for different styles. When coding DME, selecting the code that most accurately describes the specific item provided is essential. Question 22. What does the HCPCS modifier RR signify? A. The item is a new purchase. B. The item is a rental. C. The item is a replacement. D. The service was performed on the right side. Answer: B. The item is a rental. This is a straightforward question testing your knowledge of common HCPCS Level II modifiers related to durable medical equipment, DME. The concept is understanding the modifiers that define the nature of the transaction. The RR modifier specifically means rental, and it is appended to a DME code to indicate that the provider is billing for the rental of that item, not the purchase of it. For example, a hospital bed, E0250, rented for a month would be billed as E0250RR. Always remember the three key DME modifiers: RR for rental, NU for new equipment, and UE for used equipment. Question 23. A diabetic patient is provided with a glucose monitor that is calibrated for use by a blind individual. The monitor includes a voice synthesizer. Which code best describes this device? A. E0607. B. E2100. C. E2101. D. A4253. Answer: C. E2101. This question tests your ability to find a highly specific code for durable medical equipment with adaptive features. The keywords are glucose monitor, blind individual, and voice synthesizer, which indicate a device designed for a visually impaired user. While E0607 is a generic blood glucose monitor, codes E2100 and E2101 describe monitors for the visually impaired. Code E2101, blood glucose monitor with integrated voice synthesizer, is the most accurate choice because it specifically includes the voice feature mentioned. This illustrates the importance of drilling down to the most detailed code available in the HCPCS manual. Question 24. A patient is administered a drug that does not have a specific J code. How should this be reported? A. Use the J code for the most similar drug. B. Do not report the drug supply. C. Use a not otherwise classified NOC code. D. Use a G code. Answer: C. Use a not otherwise classified NOC code. This question assesses your knowledge of how to handle drugs and other substances that lack a specific HCPCS code. The key phrase is does not have a specific J code. In these situations, you must use a not otherwise classified or NOC code, such as J3490, unclassified drugs. When using an NOC code, you must also submit the drug's name, dosage, and National Drug Code, NDC, on the claim so the payer can identify it and process the payment correctly. Never choose a code for a similar drug, as this is considered incorrect coding. Question 25. An ambulance service transports a patient from a hospital back to their home. Which origin and destination modifier is correct? A. RH. B. HH. C. HR. D. RR. Answer: C. HR. This question tests your understanding of the two-letter ambulance modifiers that indicate the point of pickup and drop-off. The key is to correctly identify the origin, from a hospital, and the destination, to their home. The first letter of the modifier represents the origin, and the second letter represents the destination. H stands for hospital, and R stands for residence, making HR the correct modifier for this trip. A good tip is to read the letters as from to. This trip was from the hospital to the residence.